And you also said in your writings that the pandemic COVID should lead to a rewriting of all textbooks in epidemiology and should lead to a new way like they have in Sweden, where governments must require court orders for each individual to restrain them at home for quarantine or lockdown. So was there a precedent for these stay-at-home lockdown, canceling of weddings and funerals and closures of schools and businesses and churches? Or was this just done for the first time in at least Western human history? And how do we get out of this? You mentioned Sweden, but what is our way to prevent this? My fear is, if you listen to what Bill Gates says, in multiple interviews, Bill Gates openly says, if you want to know how to handle the next pandemic after COVID, look to what Australia did. Australia is the model for the world. Well, that sends chills down my spine. So how do we go forward here?
Yeah. So look, I've been sort of, initially I was very friendly towards public health at one stage in my career. I used to think it's a wonderful thing to do, to be public health oriented and so on. And then at the point I wrote the book from which you're mentioning these things, I thought maybe, epidemiology can actually become more sensible, not more sensible, a little bit more sensible. They just should follow the standard things, because their books actually talk about all these risk-based approaches. They talk about, the cost of quarantines, and they should not be doing this thing. WHO guidelines of 2019 are very good, and they say all the good things, etc. And of course, Anders Tegnell basically said, look, the whole world seems to have forgotten everything that we learned, which is probably true. But by now, by the way, I've done some more thinking about this, Mark, and I've written an article, a 4-part article in the Times of India blog that has been also repeated in a short form in the Mises Institute blog or whatever. And I'm planning to write a book on this issue where I actually argue that public health should be abolished. And the reason is it cannot be rescued. I think the Anders Tegnell hope that I had that's actually the true nature of public health is actually not true. I've gone back and looked at the history of public health a little bit more in detail, and this has been happening in a smaller scale from a long time. So the swine flu itself, there was a massive, a scare created. Fear was stoked by, and it's recorded in the WHO's own bulletin itself. The criticism about the fear created by during the swine flu, exaggeration, trying to control other people. And by the way, they never have any proof of anything anyway. So they can't see a virus. They don't know the individual person's immune system capacity. They have no parameters to actually prescribe anything. So even when smallpox cannot be controlled, for example, so this is a well-known lesson in public health. Yeah. In epidemiology, that Donald Henderson, the guy who actually stopped the smallpox in the world, one of the greatest epidemiologists of all times, he actually studied this very carefully and said, look, if you can't stop the first index case, the first case that enters your country of smallpox, you cannot stop smallpox anymore. And he found that the USA, with all they had done a lot of controls at the borders in the USA in the 1950s and 60s, and he said all of them failed because the smallpox had already entered the country and there was no possibility of stopping it in this manner. And so imagine if you can't stop smallpox, how in heaven's name can you stop COVID, right? So the idea of doing this kind of things, what I'm saying is that there is no science behind these guys. The masks is a further absurdity, because when they do the RCTs, the so-called RCTs, I've studied the Bangladesh RCT, the Danish RCT, etc. Imagine in Bangladesh, I've lived in the country which is pretty similar in conditions, in India, north of Bangladesh is Assam. I worked there for about 8 years, and the condition is so pathetic of these people in the villages, etc. And if you're expecting them to these guys were given masks, right, as part of the RCT, but masks cost money, right? These guys earn an average of less than $2 per head per day. So we're looking at US dollar and expecting somebody to be able to buy a mask, and they did the surgical masks mostly. But imagine somebody having to buy an N95 mask. These guys simply can't afford it. And so what they do is they will reuse it. They will make a mess. In fact, it become much worse. So the RCT idea, this public health discipline, I've explained, doesn't have the information. So you look at it from the information angle, which is, Friedrich Hayek would talk about. and of course von Mises, there is simply no possibility of the relevant information to form a view or a decision about anything to do with non-pharmaceutical interventions, NPIs, they call them, the things like quarantines and things like mask mandates and so on. So the vaccine is a different issue, and I'll come to that separately this time. But really, what I'm saying is public health as a whole cannot be rescued. That's my argument now, and I'm planning to write a book on that with adequate proofs, because already a number of people on the internet are arguing with me, professors and public health students and others. They're arguing that, why do you say that? And okay, I'll prove it to you guys a bit more, because you really have no knowledge and you cannot get the knowledge. So without knowledge, how in heaven's name can you even prescribe anything to anybody as an individual? So health must be individual, Mark, is my view. And if somebody, has got a strong immune system like Djokovic, consider this guy, he's the most fit person in the world, one of the most fit persons in the entire world, probably the fittest, I would say. And so this guy is being stopped from entering Australia on the ground that this guy will bring in some disease. Well, he's going to fight it off in minutes. And in fact, he did have COVID early. And he's been, as fit as ever before, thereafter, right? So what I'm saying is everybody is different. The virus, the way it transmits is different from place to place, from season to season, et cetera, with a million such variables. How in heaven's name can any general broad brush, remedy be even considered? So this whole discipline is impossible. I call it an impossible discipline. And of course, there are some good parts like, clean water, sanitation, and even vaccines, where I argue that, it can be potentially a useful thing to have a separate department doing that. But definitely we don't need, CDC and other such entities doing public health anymore. So my argument is to just abolish this discipline.
Well, I mean, there's certainly, I think, an appetite for people to have that debate, especially given, I call it public health authoritarianism.